Welcome to Key into Quality, the Mayo Clinic podcast where we explore the people, practices, and principles that elevate healthcare quality and safety. Thanks for joining us. I'm Dr. Tim Morgenthaler, a professor in medicine here at Mayo Clinic and a vice chair of Mayo Clinic Quality. And in this episode of Key into Quality, we're asking this question: what if every patient had a built-in safety partner, someone trained not just to move them, but to mobilize them safely and confidently? What effect would that have on healing and safety? On today's episode, we're going to shine a spotlight on the Safe Mobility Champions initiative, where the goals are ambitious, and that is to reduce patient falls, improve recovery through early mobility, and change the safety culture from the inside out. Co-hosting with me today is Sherry Nemec. Sherry?
Welcome, everyone. I'm Sherry Nemec, Consultation Relationship Manager for Quality at Mayo Clinic. Today, we get to learn about this special group of empowered staff who are role modeling the way forward in impacting both patient and staff safety.
As is often the case here, we have two very enthusiastic and passionate people, champions for change. Kelly Drilling, who is the Safe Patient Handling Coordinator leading the implementation of this project, and Marissa Cocker, who is one of the first frontline Safe Mobility Champions. And together, they're really helping roll out a whole new platform that trains, empowers, and equips care teams to recognize and remove barriers to safe movement. As a physician working in the hospital, I go in and so often I'd be worried that the patients are there in bed. And that's convenient, but that's not very healthy for healing it so often. So this is really important work that they're doing. They're teaching more than lift techniques. They're really shifting mindsets, and they're using tools like hourly mobility huddles, coaching at the bedside, wearability mobility tech. They'll tell you all about it. But the point is, it's working. And I'm just really excited to have a chance to share this with our listeners. So let's hear about how this program's changing the way we think about safety, teamwork, and healing. Maybe I could ask Kelly Drilling, could you just take a moment to introduce yourself to our listeners? Just tell them a little bit about yourself and when you came to Mayo Clinic and what you're doing these days.
Hello, everybody, and thank you for tuning in. I am Kelly Drilling. I am Mayo Clinic Rochester's Safe Patient Handling Coordinator. I started at Mayo Clinic in 2007.
We're so glad to have you. And maybe, Marissa, could you tell us a little bit about yourself? Marissa Cocker, who's a Safe Mobility Champion.
Hello, my name's Marissa Cocker. I am a Safe Mobility Champion on Mary Bry 9 D&E, which is a neurosurgery floor. I've been here for 5 years and I really like it.
Welcome.
Well, fantastic. Well, we love having you both here today, especially. So I'm just going to start, Kelly, I actually heard that you have kind of an interesting past that got you involved in safety years before you're doing what you're doing now. Tell us a little bit about that.
Yeah, in 2017, I was a nurse manager at the time, and the Department of Nursing really recognized that we needed to have some dedicated FTE for safe patient handling. So the call went out for a small work group of volunteers, leaders from the Department of Nursing. And I was somebody who I just was like, you know what, I'll volunteer. I'll be on this work group. And that work group was in place from 2017 to 2018. It took that long. But anyway, our efforts were trying to align education with safe patient handling, make it more consistent, trying to develop a way for the nursing leaders in our department to ensure that all the staff had the same confidence and competence when it came to safe patient handling equipment. So I was on that group, and we were able to be successful in establishing Mayo Clinic Rochester's very first safe patient handling coordinator, which is what I do right now. I helped develop the role that I kind of took on a couple of years later. And I've always been passionate about safety. I've been a psych nurse. Safety is my deal, and I love it so much. Very passionate.
That's wonderful. We have had the opportunity to talk with some other team members from the Safe Patient Handling Committee and that group, also talking about some inpatient falls, some outpatient falls, preventative measures with some of your colleagues. But let's dig into this Safe Mobility Champion piece. So you're in the role. Tell us how you moved into this space.
Yeah, absolutely. I took on the Safe Patient Handling Coordinator role in 2022. And when I started, I had formerly been a nurse manager. And so I kind of lost a little bit of like committee involvement and structure and work that I was doing as a nurse manager or a nurse leader. And when I took on the Safe Patient Handling Coordinator role, it just looked different to me. And I thought, okay, I need to be back on these certain committees and certain groups. And so I tried to put my hand in almost every single cookie jar, I like to say. And that included falls and naturally safe patient handling, right? Because that's what I was hired into. And as I got into like a lot of these other groups, quality, safety, value analysis, things like that, but especially falls and safe patient handling, I recognized right away I was the only constant throughout a lot of those groups. I would get called out a lot, which was wonderful, but they would say, Kelly, you have line of sight to this because you're on that group. And the other group would say the other thing. I became a little bit of a middleman. It was okay, falls and safe patient handling are operating in silos right now. And so I knew that one affected the other as well, right? You have a patient fall, you want to talk about what type of safe patient handling equipment was used, or maybe there was a missed opportunity or something like that. And so with my line of sight, I kind of set out to create a role where one person on any given area that does handling, not just nursing, but any area that does handling, moving, lifting. I wanted one person to embody both falls and safe patient handling. They could become an expert in both because they need to be at the table for both conversations when one doesn't go right. And so we wanted to put that merge or marry falls and safe patient handling. I was able to kind of take that idea forward and socialize it almost immediately. I took on this role in October of 2022, and I was talking about it in November of 2022. And so it was something that I was able to recognize right away. And then it was like, what do we call this role? Well, then we wanted to incorporate that word mobility, not necessarily the word falls or anything like that. So we wanted to kind of merge it. And so what we ended up calling it is the Safe Mobility Champion, which is what Marissa is. And she is just an amazing safe mobility champion. But yeah, we were able to kind of socialize it, take it to a variety of key groups within Rochester, as you guys probably know, but safety and quality, environmental health and safety, everybody had to hear about it. I needed everybody on board because I knew that if I had one large group that maybe wasn't a fan of this merged role, that I wouldn't get it off the ground. But I was able to communicate the vision and nobody said no, which is wonderful, Dr. Morgenthaler. I know it's wonderful not to get told no, right? But they could hear my vision and understand how important it could be. And when you put such powerful things together like falls and safe patient handling, we actually were able to elevate that role in committee structures as well. So it wasn't a staff member on the floor just talking about falls or anything like that. This was an elevated leader in their work area where they were able to kind of embody both falls and safe patient handling.
I want to just take a pause for a second because you've been talking a lot about the building the people part of how things change in healthcare, which is super important. I want to just back up. Some of our listeners are nurses, some of our listeners are physicians, some of them are administrators, some of them are just morosely curious about what goes on in healthcare. And so they're listening to us. I want to break down a couple things. So going back, we have people in many places that worry about patient falls. And a lot of times those are sort of on the safety side of the house. They're analyzing why did the fall happen? They're analyzing who's at risk for falling. What are the methods that we have to try to reduce falls? And maybe not everybody who's listening to this know, but patient falls is a huge safety problem in the hospitals. You wouldn't think it would be the case, but people don't always know that they're not very stable when they're sick. And they get out of bed and they go do things that they ordinarily would do at home. It's not a problem, but oh, I've got pneumonia, I'm hypoxic, I haven't been up for a while, I'm dehydrated, they're not safe. So things happen and they get injured and it's a bad problem. So that's the fall side of the house. But the other side of the house is that many of these people need assistance getting out of bed or encouragement to get moving. And when they're being assisted, we have sort of an occupational health side of concerns in the hospital. That is, we want to preserve our nursing and patient assistants' backs and not have them injured or not have them on their way to injury while they're trying to prevent the patient from falling. You mentioned actually safe handling equipment. How many different kinds of safe handling equipment would I encounter if I took a tour of St. Mary's Hospital? What am I going to see?
Oodles of things. In the hallways, we have our ceiling lifts and a track around our entire unit so that if we wanted to use a walking sling with a patient, that would be one of the first things you would encounter while looking around our unit for safe patient handling equipment. We have Sarah studies, we have our gait belts, we have walkers for our patients. We have our ceiling lifts in every one of our patient rooms. We have different types of slings that we can use with our patients.
Yeah, that's a lot.
You've got different kinds of lifts, and each one of them has certain purposes and certain ways to safely operate them, both safety of the patient and safety for this. I don't know, I've never counted it, but as we've been talking here, I'm sure there's 30 different pieces of equipment or more that we'll need to understand how to use properly.
Right.
But then what I love is, so you've been kind of combining here the safety side of things with the occupational safety side of things, but more importantly, you're leaning in and talking about mobility. So
And prevention.
tell us about mobility and why that's good. I mean, we could prevent all falls if we just staple everybody to the bed. So tell us what mobility does for our patients.
So mobility is super important. We know that the typical hospitalized inpatient, they spend the majority of their time in bed. So sometimes patients actually leave the hospital sicker and more deconditioned than they were when they came into the hospital. A lot of people don't really think about it that way. So our efforts in promoting mobility means that we want to make sure that we're not only fighting, we're making progress. We want to make sure that our patients are discharging in either the same mobility state that they were in or even better. And so we've got teams that work with our patients like physical therapy, occupational therapy, and then, of course, nursing, general service. We all want to keep mobility in mind because we want to make sure that our patients are going to be able to take care of themselves when they go home. We don't want to have to send a patient home sicker than they were in terms of mobility than when they came in.
Let's jump over to Marissa because I'm just interested in hearing from her about what motivated you to become a champion and what do you do for your role? What do you like best? Please share with us.
I'm a patient care assistant, and my role is helping to care for the patients here on this neurosurgery floor. So we've got all different varying types of abilities on our floor. Some patients can be standby assist, where they need little assistance from us, and then other patients can be completely dependent on our care and not able to move any parts of their body. My job is to make sure that we're mobilizing our patients to the best of their abilities and then also keeping ourselves safe while doing it.
Okay, so Marissa, just tell us a little bit about what motivated you to become a safe mobility champion. Tell us a little about your role. Just interested in learning more.
When we were asked if there was anybody on our unit that would like to be a safe mobility champion, my ears perked up and I thought, that sounds interesting. I'd love to know more about it. And then I read the email and everything. I thought it would be great to know more about how to safely mobilize our patients. There's been times where we're standing in a room trying to figure out how to get a patient moving and wondering, well, what kind of equipment should we use? Or what should we do here so that we can do this safely? So it was very interesting to me. I just wanted to learn more about it so that I could share it with my colleagues so that we would have just more confidence in our role.
So tell us how you interact with others. We heard about how you guys are really the content experts to help support the rest of the folks. Tell us more about that.
We love going to our little meetings as a group with Kelly leading it, and we learn all sorts of awesome things about how to safely transfer patients, how to use the equipment. We're able to ask questions and get like direct feedback. We're able to see the numbers of like falls that we've had or workplace injury reports, things like that. And so it's really rewarding seeing those numbers.
How would the colleague of yours reach out or connect with you for your champion role?
Right. So we are kind of like a go-to person when we're having to troubleshoot how to get a patient moving safely, whether that's using a Seroseti or a sling or, just trying to navigate what are the patient's abilities at this time and how do we safely move them from the bed to the chair or even to use the bathroom. So my colleagues would call on me to help them assess the patient's needs and recommend different equipment.
Can I share something about Marissa? Part of my role is to visit physically every single nursing unit, both campuses that we have here in Rochester for Mayo Clinic. And when I was up visiting her unit, she was able to attend the meeting, which is wonderful. I need to meet with the nursing leaders, but I also want to meet with the Safe Mobility Champions. So the Safe Mobility Champions are also invited to this physical meeting that I have where I look at the environment, I look at the equipment that they have present. I talk to the safe mobility champions that are there. And during this meeting, Marissa blew me away because she was sharing what she does in her unit based on some of the content that she learns at these events. So Marissa did mention these events. We do have quarterly gatherings of the safe mobility champions in the biggest room we have on campus because we have so many safe mobility champions. We have about 200 safe mobility champions that physically come and attend these quarterly events, is what we call them, where half the content is what she mentioned, data on falls and safe patient handling, exertion injuries, tips and tricks. And then we always talk about leadership as well, because that's really important for our safe mobility champions to recognize that they are leaders in their area. And then the second half is hands-on working stations where they get to be face-to-face with a subject matter expert. We change it up every single time. And what Marissa did is she took a year's worth of content that she learned at these events and put together this customized content for her nursing unit and presented it at one of their professional development days, which is a gathering of staff where they can teach each other things, they can learn different professional items from their leaders, things like that. But she took it upon herself to literally go through all of the content, all of the videos, compiled what was important to her and her staff and her unit, and disseminate that information in a very meaningful way.
Marissa, that's so cool. I'm just kind of curious. You're both obviously passionate about what you do. What's your favorite thing about being a mobility champion?
My favorite thing about being a mobility champion is being able to help patients be able to start moving their bodies after some pretty major surgeries and being able to ensure that the patient is safe and help give them the confidence that they need on our end, that we're here for them, we got them safely, and they can start moving their bodies in a meaningful way that adds value to them and just helping them with their confidence. So it's very rewarding seeing a patient taking their first few steps after like a spine surgery and then being able to regain their strength in a confident way.
Wow. I just want to say thank you for doing that on our patients.
Yes. Well, it's so important, right? Not only their safety in the hospital, but for when they go home too, right? We don't want to have them coming back because they fell at home.
So, Kelly, you spent the time merging these things together, and you now have a program. You're visiting every unit on the hospital. I think in the downtown campuses, there's 70 something units on downtown campuses. You have meetings with over 200 of these mobility champions. So, what's the current state of the project then? You have a lot of things going on. Are we seeing results?
Good question. Yes, we are. With exertion injuries, our Department of Nursing, I'm just speaking Department of Nursing right now, Rochester, we are at our lowest exertion injury rate than we have been in at least 3 or 4 years.
Just for our listeners, our hospital census is the highest it's ever been in the history of the world. So it's not for lack of being busy. We're very, very busy. So that's quite an accomplishment to
Yes.
much more complex care. The average patient needs a lot more care, and to have that kind of statistic is wonderful. I was going to say, what do you think the impact is on patients? But you've kind of told us about staff. What do you think the impact is on patients of having the mobility champion, mobility mindset? Marissa?
The patients are getting out of bed sooner and being able to mobilize and participate in their care and being able to self-advocate for themselves in a more confident way because they know we want them moving and they generally want to be moving as well. And so just adds to their overall sense of well-being and just knowing that they have such a good partner with them to be able to help them feel confident in discharging or moving on to the next step in their journey.
Which I'm sure is a positive impact to patient experience as well.
Oh, yes, absolutely.
And I'm sure you're right, because if you focus on things, they get better, usually, and you're doing that in a beautiful way. Do we measure that in some way? Do we measure patient mobility, hours till movement after surgery? I don't know how do we measure that?
Yeah, that's a good question. How do we measure mobility? Right now, the staff are focusing on implementing something called the Bedside Mobility Assessment Tool. We're performing a little mini focused assessment with them to see, can they march in place? Can they reach out and shake their hand? Do they have trunk support? All those little tests that we can do with the patient help us understand what type of equipment might I use with this patient to help mobilize them earlier, rather than what we've all kind of said. We don't want our patients lying in bed deconditioning or anything like that. So right now, that's what we're doing with the patient. And I think right now, like when we look at culture and we talk about culture of the patient satisfaction, but also culture of like the staff and talking about that word mobility is a hot topic right now, which is wonderful because staff are talking about it with their patients right at the beginning of admission. We're using that word when we're doing our assessment, which we weren't doing that a couple years ago. So that word mobility is really promoted with our patients, but also for our staff. And I can really sense it within the culture. And Marissa, I don't know if you have anything else to add for like what you hear about mobility and that sense of culture around it.
We have been able to implement a better culture, especially on our unit for mobilizing patients, but also doing it in a safe way for us, making sure that we have enough staff helping out with the transfers, and then making sure that we're using like safe body mechanics and the right tools, equipments and such.
I can feel the difference in the language use. If we talk about preventing falls or we don't want you to fall and shifting that to this positive mobility language, it changes the whole conversation.
It does. It's the difference between I'm going to heal a disease or I'm going to promote health.
Right.
I'm going to prevent this bad thing or I'm going to create a beautiful thing. So that's really cool. Thank you for sharing where you're at. So what are your next steps and where do you go from here?
So we're going to continue on with our quarterly Safe Mobility Champion events, which have been well attended from the very first one, which was January of 2024. We're going to continue holding them quarterly. We're going to continue to change up our content, which we also have been doing every single session. We don't want people coming back and saying, okay, I've heard this content before, or I remember Dr. Morgenthaler, you talked about that same thing 3 months ago. I remember that. We want to keep helping them evolve and to continue to become stronger and stronger leaders and changes for culture within their work areas. So one thing that I'm really excited about in our next session in the fall is that we're going to have a couple people coming from X-Tech. Dr. Morgenthaler, maybe you can explain a little bit.
That's our experience, training, education, and coaching team at Mayo. We call them X-Tech. Yes.
So we've got a couple people coming from X-Tech, and they're going to be helping the audience, the Safe Mobility Champions, understand how they can have a conversation in front of a patient with a colleague when it comes to safe mobility or movement of a patient in the event that we have differing opinions. So if I want to use the ceiling lift and Marissa doesn't, and we've got our patient here, how can I have that conversation in a professional and a respectful manner and quickly also turn the conversation around? So something I might say would be, hey, Marissa, we're really focusing on using the ceiling lifts right now. That's our expectation. Why don't you help me hook up the loops on your side and we can get our patient moved safely?
Wonderful.
Couple of seconds and I can turn that conversation around, and hopefully Marissa is going to be receptive of that conversation as well.
So we always like to ask our guests here if I'm a listener and I'm like, wow, this just sounds amazing, the work that you're doing in this space. What would you say to someone who wants to get started in this area? Any tips or first steps?
On creating a brand new role within a large organization? That's a very good question. Yes, I would say identify your key stakeholders, get them on board, develop your elevator pitch for them so that you can kind of get that buy-in right away. You want to have that buy-in right away so that every conversation you have with that person, that group, or that committee thereafter, you've got some ground already gained. And for us here in Rochester, safety and quality and occupational health, those were key groups that I needed that buy-in immediately. And so sharing my idea and then also the Joint Commission, they also support that merging and synergy of falls and safe patient handling. So there is also the Joint Commission kind of sharing that, hey, this is a best practice and this is something that organizations should do and can benefit from such a role merger like this.
Well, wow. I guess we're going to have to wrap this up here because we're getting at the limits of our time. But I just want to express gratitude to both of you for sharing your passion, your experience, your wisdom, your learning, and your vision for this. I think what we've heard about today is so much more than a change in workflow or title. I mean, I really do think it's a change in vision. Safe mobility isn't about just preventing harm. Everybody wants to prevent that, but it's really about restoring dignity and accelerating healing, It's about creating space for that human connection at the bedside and maybe even perfecting it with additional education. Champions like Kelly and Marissa, I think, just show us what's possible when we equip and trust our frontline staff to lead. And that work reminds us that every single step that a patient takes, when supported safely and intentionally, is a step towards recovery and restoration and confidence and hope. And we want to be about hope in healthcare. If we want safer hospitals and healthier patients, we need to keep on asking, who else can we invite to walk this path with us? And so thank the two of you so much for being here and for sharing what you have to say.
Thank you. This was a pleasure. Thank you so much.
Yeah, thank you.
So we've come to the end of our podcast, and we're glad that you all could join us, and we hope that the information provided has been valuable and insightful. Again, Mayo Clinic's Key into Quality podcast aims to highlight some of the first steps in addressing important quality challenges in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed this podcast, we'd be grateful if you'd leave us a review on Apple Podcasts, a rating on Spotify, or feedback wherever it is that you listen to this podcast. And you can also follow us on your favorite podcast platform. Please let others in your organization know about the podcast so the information can be spread. Until next time, goodbye.